Welcome to Peace TV, positive events in arts, culture, and education television. I'm your host, Marie. Peace TV is here to inspire you and to educate you on the positive things that are happening in your community. So if you want to see some positive things happening in your community, we're going to challenge you to represent and do something about it. Today, we are at a symposium at the Debo Tech Center at Stark State College discussing health through the Minority Health Coalition. Barbara Currens, Councilman Thomas West, many people, Vince Watts, they were all involved in putting this event together. There are every mover and shaker from the community that is involved in healthcare or social services is here today discussing how we can address the disparities of healthcare. And trust me, there are a lot of disparities, and we are really alarmed at some of the things that we're finding out about it through the statistical data and all the information that is available. But what we want to do is we want to seek solutions. So today they're here to see what kind of solutions can we come up with that can kind of curtail some of the things that are going on in our community as far as healthcare is concerned, and what can we do action-wise to make something happen. So stay tuned, check it out, and see what you can do at home to change things around here. I'm here with Barbara Currens of the American Cancer Society, who is also chairperson of the Stark County Minority Health Coalition, and she is put together this wonderful symposium. What made this happen?
Well, actually, this event came about as a result of a grant through the Ohio Commission on Minority Health and the sponsorship of Mercy Medical Center here in Canton. Excellent. And this is a dialogue that's taking place in 14 other cities in Ohio, and also with other ethnic and racial groups to try and get a handle on the health disparities that exist within each local community.
Now, why are these discussions so important?
Well, obviously because minorities die at a greater rate than any other population. They suffer from every other disease at a higher number. For example, for cancer, for instance, minorities die at a rate of 2 to 1. And the problem with that is access to health care. Typically, when we're sick, we go to the doctor when we're almost on our last leg, and by then our diagnosis is in critical stage. And that's the case with almost every disease that impacts the African American community.
Wow. Now you have a lot of movers and shakers of the entire community, the health field and social services fields right here at the symposium today. What are you hoping that they will accomplish at the end of the day?
Our hope is that at the end of the day, we will have reached a conclusion about the needs for our community, Stark County community, and have developed some strategies as to how we want to proceed to reduce the disparities that exist.
The mission of the Minority Health Commission that was stated on the bottom of one of your programs is kind of long and convoluted, but to me, it really identified, the crux of it is to identify possibilities. And it's the possibilities for people to have healthy and productive lives in our community. So I welcome you to be able to come here and share that with us. I think our challenge is this. This is a very unique gathering. Never before, probably never again, will this type of situation happen within our community. It's very unique to us. It's unique to us today. And your experiences, your knowledge, your sharing is critical for us to begin to build a process of creating these possibilities in our community. And so that's your challenge today, is to share those possibilities with us, to listen and learn from other people, and to help us grow as a community.
This is our opportunity and our place in history to make a difference for the people that we serve, the people that we love and care about. It is our time in history to impact the opportunity for people to have life, liberty, and the pursuit of happiness in this country. It is our time to make a difference. We have an opportunity in our lifetime not to just do something today, but to do something for our children and our grandchildren. Your reason for being here today is to lend your voice to the next national report that will be done to address issues of health disparities in this country. That report will be released in February next year in Washington, D.C., and we have made it our business and we're making a commitment to all of the local conversations in Ohio that we will invite one person from a planning group from every city to represent the people of their city in Washington, D.C. in February when that historic report is issued. And it's not just being issued as another document, but as a blueprint for action for what we need to do to guarantee life, liberty, and the pursuit of happiness in this country.
What are some of the statistics that you were seeing? I'm sure you can't spout them off at the top of your head, but is it safe to say that there are some very vast disparities?
We know there are disparities in early death and premature death between minority populations and white populations. We know there's disparities in the rates of infectious disease, like sexually transmitted infections such as chlamydia, gonorrhea, and HIV. And we know that there are many, many reasons for that. And part of the purpose of the conversation is to identify, as a Stark County community, what can be done in our community to help address some of those disparities.
What are some of the things that you think can be done to address some of the disparities?
Oh, and that's the purpose of the conversation. If I knew that answer, we wouldn't have to have a conversation. But really, I think that the solution for some of these disparities and some of the programming that we can do for that really comes from the community that's affected. And so we're really here to learn from that to try to help the community address these issues.
This is a great symposium that you all put together. What made this come to fruition?
There is a movement at the national level from the Federal Office of Minority Health for a program called the National Partnership to End Health Disparities. And so what's going on here is happening all over the United States. Will culminate in a blueprint for elimination of health disparities in February of next year in Washington. And so candidates joining cities all over the United States, going to communities, finding out what people think the problems are, and even better, what the solutions to the problems are.
Excellent. Now, are you all going to fund the solutions to these problems so that these things can be kind of changed?
Well, I'm going to share with your audience because the fact is the commission is 25 years old, and we have been providing grant funds for 25 years for culturally specific programming. And so we have underwritten the cost of this. We do have some federal funds that we will provide some of the money for the strategic planning. And so our commitment to the communities has been from the very beginning, and that's not going to change. The bigger issue is that we're a small agency with a small budget. How do we impact the system to be responsive to the problem? And I think that this blueprint will help do that.
There are approximately 47,500 Stark County residents who are not insured, who do not have health care coverage. Of those 47,500, about 25,500 are families who are at 200% of the federal poverty level or lower. And that is the group, that's the large group that we are looking at when we're talking about developing an access to care system. The reason that group is important is because they are not, the very poor are covered through Medicaid, so they have health care coverage. And we know that health care coverage increases access. I'm going to talk about that in a little bit. But these are primarily the working poor who are working, they have families, but they do not have health benefits through their job, and they, on their incomes, cannot afford health care.